Activity modification is another way you can take control. Generally speaking, you want to limit activities that will use repetitive fisting or prolonged gripping or pinching. You also want to avoid extreme postures, such as flexing the wrist or extending the wrist, and avoid direct pressure over the carpal tunnel area. Now I'd like to review some specific activities that will increase carpal tunnel syndrome symptoms. Sleeping posture is extremely critical to maintain healthy wrists. First of all, don't sleep with your wrists curled up and bent. This posture will increase symptoms. Next, avoid sleeping with the weight of your head leaning on the carpal canal. This is the direct pressure and will increase your symptoms. When sleeping, it's very helpful to use night splints, as Nancy reviewed earlier. When carrying heavy objects, don't carry them with one hand. Instead, always use both hands to minimize the weight of the load in the carpal tunnel. Using both hands will disperse the weight and minimize stress. When driving, it's important to not grip the steering wheel with your wrist bent. You should also avoid a tight grasp that you can often incur during stressful driving situations. When driving, keep your wrists straight, lighten up on your grip, and perform some tendon gliding when you're stopped at red lights. Another activity you'd need to change is when you hold a book with a tight grasp while reading. This tight grasp is a forced pinch and will irritate your symptoms. It's better to rest the book in an open palm position, freeing up your grasp. Another suggestion to hold open a book is to use your fingers. This avoids pinch, but will help keep the pages open if the book does not have the weight to keep its own pages open.
Hello, and we're here with Dr. Richard Herrick from Tampa Bay Orthopedics in St. Petersburg, and we're going to ask him a couple questions. He is a specialist in hand and upper extremity surgery. A question for carpal tunnel. What test do you order to determine if a person has carpal tunnel?
Well, firstly, I believe the physical exam is more important than anything else. The history and the physical are 90 to 95% of what I need to determine whether somebody has carpal tunnel syndrome. If there's a question about whether the severity is enough to consider surgery, or whether there's a question of whether there's a significant component from the neck or the elbow or somewhere else, then I get EMG nerve conduction studies. Also, there are some insurance companies that require that we have something more concrete than my word, and those are the ones who also get the EMG nerve conduction studies. But that being said, there's around a 10% false negative EMG nerve conduction study results, meaning that the patient is very definitely a candidate for possible surgery, certainly has the diagnosis of carpal tunnel syndrome, and yet the electrical studies are normal. And then if you're going to add this as a possible potential treatment or a test, you could always inject a little corticosteroid, the local anesthetic, into the carpal tunnel itself, carefully of course. And if they get a significant amount of relief, especially for more than just an hour or so, and the symptoms disappear completely, you have at least another objective test that you have made the correct diagnosis. And sometimes it actually works for a while, but in my experience, it rarely ever cures the situation. It's more likely to be needed in somebody who either is not up to surgery, is not convinced they want to go through surgery, or they have hopefully a temporary condition such as pregnancy that they may have the carpal tunnel syndrome disappear once they deliver the baby.
Okay, that answers a little bit of the next question too. When do you ultimately decide that surgery is needed for the patient?
Well, if they already have atrophy, and atrophy that's significant enough you can see it and feel it, it's time for them to have surgery unless there is such a terrible problem health-wise that would mitigate against that. They really need surgery. Otherwise, if the symptoms have been there only for a short period of time, anything less than 6 months, it certainly warrants a trial of conservative care, meaning everything except needles and knives, and try splints and whatever else you might want to try. But I think it's a matter of severity, what the patient is doing, what they want to do. If they're an elite athlete and it's imperative that they return to their activity level as quickly as possible and they have a moderate or severe case, then you discuss with them doing the surgery earlier.